Vitamin A deficiency is the leading cause of preventable childhood blindness and increases the risk of death from common childhood illnesses such as measles and diarrhea. The World Health Organization has classified vitamin A deficiency as a public health problem affecting over 250 million children in over half of all countries worldwide, especially in Africa and South Asia.
Vitamin A deficiency can manifest in a number of ways. The one that is really important is in children 5 years and below who are vitamin A deficient. They're more likely to die from common childhood illnesses. It reduces their immunity, and so they're more prone to infection and death. Vitamin A deficiency can also lead to effects on our vision. Night blindness is a common manifestation of vitamin A deficiency, as well as a condition called xerophthalmia. Xerophthalmia is when the cornea, it's like a drying out of the cornea. The latest food consumption survey tells us that amongst children 5 years and below, vitamin A deficiency is 29.5% prevalent. About 24.5% of that is moderate vitamin A deficiency and 5.5% is severe. So it's quite a serious problem here in Nigeria.
Since interventions addressing vitamin A deficiency have been shown to reduce childhood mortality, Helen Keller International, in collaboration with government and developmental partners, have adopted 3 main strategies to address this problem.
The first one is a short-term measure, which is to provide vitamin A supplements to the target age group, which is children less than 5 years of age. This needs to be done every 6 months to ensure that they have adequate stores of vitamin A within their system. And it provides them a store of vitamin A that would last from 2 to as long as 6 months in some cases.
Vitamin A supplementation during child health events have enabled many developing countries achieve substantial vitamin A coverage.
Helen Keller International has been involved in addressing vitamin A deficiency. One of the ways we do this is through what we call the Maternal, Newborn and Child Health Weeks. It's a national campaign. It holds in all 36 states, plus the FCT, and it's a government initiative. It has provided a platform through which vitamin A supplementation can be provided to children 5 years and below.
The Maternal, Newborn and Child Health Week, the process actually takes place in 3 phases. During the pre-implementation stage, we carry out planning meetings where we plan and budget. During that stage, Helen Keller International actually focuses on social mobilization, where we air our radio jingles in the 8 states and in different languages, and we also do some community mobilizations.
If the fever didn't go after 3 days, come to the clinic. Don't listen to your neighbor.
This week is full of packages from government. We attend antenatal cares, in which we give mothers who are pregnant, then children from birth to 59 months. We attend to them, give them the normal immunization, then we give them vitamin A, which improves their eyesight, help in the growth of the children.
You know vitamin A? What is the function of vitamin A? Please, mother, to your baby.
So I saw the banner on the gate of this hospital, this healthcare center. I saw the banner on their gate there. So when I now saw it, I read through it. So that is why I came to receive the treatment. So they said the vitamin A that is good for eyes, for vision. So and also to build the immune system of the body, of the baby body.
So vitamin A supplement is very important to the body. And we have a lot of food that contain the vitamin A. We have something like carrots, any food that is yellowish in color, like tomatoes, they are very important.
Helen Keller International have been able to reach many children with vitamin A supplementation. In 2012, in 9 states, we were able to reach over 5 million children who were aged 6 to 59 months. In June 2014, Helen Keller International worked in 8 states and were able to reach over 6 million children aged 6 to 59 months with vitamin A supplementation. Nationally, we have worked with other partners to reach over 30 million children in the whole country.
The second strategy is designed to reach even more people in Nigeria.
So one of the approaches is what we call food fortification, which is a long-term approach used to be able to reach the whole population. And what is done basically is just addition of vitamin A into some selected food vehicles, which are processed foods, which we know are cost-effective and can reach the whole populace. There are also food vehicles, there are also foods that are easily accessible to people and people can utilize on a day-to-day basis. We have the flour, we have vegetable oil and also sugar that have been fortified with vitamin A. Helen Keller International with other partners have been in the forefront to provide technical advice, technical support, technical knowledge to the food industries on how to conduct food fortification using the proper methodology, the proper fortificants, and also ensuring that the product that gets to the market provide the essential nutrients that the food is supposed to carry.
The third strategy is to reach the entire population, especially the urban poor and rural dwellers, with their daily requirement of vitamin A through foods like carrots, tomatoes, and orange flesh potatoes, which Helen Keller International is currently promoting.
This orange flesh sweet potato is very, very good for everybody, not just for women and children. And how is it consumed? You can chew it raw by just washing it very clean. Or you can also boil it and just add oil and salt. You can also fry it, like fries we have, we use for our breakfast, and you serve it with fried egg or sauce. You can make it into other products. There are so many products that can come out of it, like juice, like chips, like you can even make it into cake, into chin-chin, into donut.
Orange flesh sweet potato is rich in beta-carotene, which is a precursor of vitamin A. And the good thing about orange flesh sweet potato is that even a small-sized sweet potato, as smaller than my hand, is enough to give a young child all the vitamin A that they require for a day. So it is very rich as a source of vitamin A. And we've been working with government to create the awareness, to ensure that people have access to the vines and are able to grow the crop.
Orange flesh sweet potato as a crop is an easygoing crop. And I always tell farmers, wherever most other crops will not thrive, if you put orange flesh sweet potato there, you are sure of getting something.
I planted this potato, and I know by planting it doesn't give us any problem, and it grows faster than other potatoes. So, and by the time it started germinating, we one day observed it, we uprooted it and tried to have a taste of it. I know it's very beautiful potato.
In a plot of land when you plant orange flesh sweet potato, the yield you are going to get there will be about 2 times the yield of what you get of white flesh sweet potato, because it yields very, very high. For instance, the ridge that I used to plant, I used to harvest 1 bag of ordinary white flesh sweet potato. The same size of ridge, I'm able to get 2 of orange flesh sweet potato. So the yielding in terms of yielding is very, very okay.
Our plan is for government to take over the supplementation by institutionalizing vitamin A supplementation and putting it into routine services so that caregivers can walk into health facilities and receive vitamin A for their children any time of the year.
If we had more partners, more involvement, more private sector involvement in the fight against vitamin A deficiency, what would that translate to? That would mean that more families would ensure that their young children benefit from the services that provide vitamin A supplementation. It would also mean that more Nigerians would have vitamin A rich crops as part of their diet.
We expect that with food fortification coupled with vitamin A supplementation, we'll be able to reduce to the barest minimum the incidence of vitamin A deficiency.
In the next 5 years, I see Nigeria providing vitamin A supplementation routinely in all our health facilities, and Nigeria also having more healthy children and having less infant mortality and infant mobility.
I'd like to thank all our partners that have been involved in the fight against vitamin A deficiency in Nigeria, both government and development partners. I'd also like to invite those who haven't been, because this is about our children, about their future, and about the next generation. Come join the fight.